In Sierra Leone, a growing number of young people are becoming addicted to an illegal drug known as kush. Its precise ingredients remain unclear, and the drug has become a cause for concern with authorities. From Freetown, Arikawa looks at efforts to combat the problem. Let's take a look.
Kush, a synthetic substance that users say takes them to cloud nine. However, its usage can lead to health complications and sometimes death. Despite efforts to crack down on kush, users say the drug is widely available in Sierra Leone.
I'm fully supportive of the initiative to stop the use of kush in our country. However, I smoke kush because it helps ease my stress.
In my view, there should be employment opportunities for young people, regardless of their qualifications. This will help alleviate the situation because one cannot leave a place where they earn income to engage in smoking kush.
Users face not only discrimination from the communities, but also violence.
Sometimes, when we loiter at people's houses, sleeping and nodding, they resort to beating us after having chased us away for a while. This leads to some users to nod off in the streets in an attempt to relieve stress after smoking.
Sahid Bangura is a social worker who engages young people and communities on the issue of substance abuse.
Many Sierra Leoneans don't understand that addiction is an illness. In some points, we've been hearing stories of people who beat addicts in various communities. They name and shame them. The stigma is getting high in various communities. We've engaged religious leaders, interfaith conference, wherein we encourage religious communities to come together for them to know that when one has an addiction, it's an illness.
The Sierra Leone Psychiatric Hospital treats patients with mental health issues often linked to the substance abuse. However, with limited resources and space, a limited number of kush users manage to get the help they need.
We have seen people becoming addicted to kush by single use of the drug, which is usually not common with other substances of abuse. You actually have to be using the substance for a considerable period of time before you get addicted to it.
Dr. Juso estimates that the majority of kush users are aged 16 to 30, with an average age of around 20 to 22. He notes that more men are users as compared to women. While the battle against the kush epidemic continues, the growing call for action and a solution remains a major concern for many people in Sierra Leone, as it is ravaging the lives of many young people. Erikawa for CGTN, Freetown, Sierra Leone.